So next is V16, and we're on a hydrocele in a child. So you're asked to review a 3-month-old boy with unilateral scrotal swelling. The right-sided swelling is irreducible, non-tender, and you can get above it easily. What is the likely diagnosis? So straightforward, hydrocele. So differential diagnosis: hydrocele, hernia, hydrocele of the cord, trauma, and testicular torsion in the three-month-old boy. What are the different types of hydrocele? So hydroceles can be communicating and non-communicating. So definitely there are 4 types: vaginal hydrocele, most common; congenital hydrocele, where process is patent in the peritoneal cavity, and usually resolved within the first 6 months to 12 months of the life. And then is the infantile, and then is the hydrocele of the cord. What is the cause of hydrocele in an infant? Most common cause is due to the patent process in vaginalis, which communicates with the peritoneal cavity, and this occurs usually as a result of failure of tunica vaginalis to obliterate after testicular descent. How would you manage this child? So reassure to the parents that it might start left 1 year. If not, if pressing on the card, then it can be fixed after 2 years. And repair consists of high ligation of processus vaginalis at the level of the internal ring. The distal hydrocele sac is opened and drained, with the open sac being left in place. Reaccumulation is uncommon. What are the contents of spermatic cord? So genitofemoral nerve, autonomic nerves, and branch of ilioinguinal nerve supplying the chromosteric muscle. And the ilioinguinal nerve itself lies outside the cord. And 3 arteries: testicular artery, artery to the vas deferens, and the cremasteric artery. Other structures: vas, pampiniform plexus, and the lymphatics. Now hydrocele in the adult. A 32-year-old man with a swelling in the right side of his scrotum. He first noted it about a year ago, and it has steadily increased in size since. It is not painful. What are the differential diagnosis? The differential here are include the hydrocele, number 1. Number 2, hydrocele, hernia, abdominal cyst, varicocele, or testicular neoplasm. What clinical signs would support the diagnosis of the hydrocele? Hydrocele usually slowly and uniformly enlarging, painless swelling, confined to the testis, usually inseparable from it. It's inseparable from the testes, normally firm and transluminate. One can easily get above it. What is the definition of hydrocele? So hydrocele is an abdominal collection of serous fluid within the tunica vaginalis of the testes, which form the outer covering of the testes. How are hydroceles classified? So hydrocele can be classified on the basis of the etiology and the types. Etiology may be primary or secondary. Primary, idiopathic, appears gradually and become large and tense, and secondary due to another pathology in the testes, which could be in the form of trauma, tumor, torsion. Trauma, tumor, torsion, reactive hydrocele, abdominal following renal linear repair, and lymphatic obstruction. Hydrocele can also be classified as a communicating and non-communicating. Is ultrasound useful in the routine assessment of the hydrocele? If it's straightforward, definitive, no suspicious signs, no. If any suspicion, ultrasound can rule out the testicular tumors. Then is the what are the treatment options? Non-surgical and surgical. Conservative: if underlying malignancy has been excluded and it's very small hydrocele, just reassure the patient and reassure. Surgical: we have Jablu's repair, where we drain, evert, and stitch behind the posterior to the testes. Lord's plication: the sac is plicated with a series of interrupted stitches to the junction of the testis and epididymis. Aspiration is not advised, as it potentially needs infection, and the recurrence rate is high. How would you consent for hydrocele repair? So discussion of the nature of the procedure, risks and benefits. I would ensure that I counsel the patient regarding potential complications, including scrotal swelling, discomfort, bruising lasting several days, bulky feeling around the testicle, hematoma which may require surgical treatment, infection requiring antibiotics or surgical drainage, and recurrence 5 to 10%. Thank you.